Welcome back to Rural Health Today. This episode is another installment in our season on maternal care and rural health, where we're talking with maternal health experts about rural maternal morbidity, genetics, mental health, and more to understand the barriers to proper maternal health care in rural America. Today, we're revisiting our season on maternity care for a Rural Hospital Answers episode, where we ask our guests a question or two about something our listeners want to know. I'm excited to introduce our guest today, Karla Weng, Director of Program Management at Stratis Health, and we are working very closely with Stratis Health right now on a project which will be in a future episode of our podcast, but it is great to have Karla on our podcast for the very first time. And Karla, welcome to the Hillsdale Hospital studio and to Rural Health Today. It's great to have you here. Why don't you tell us a little bit about yourself and your role at Stratis Health to give our listeners an overview of yourself and what brought you to your organization and to this field that you are so passionate about.
Yeah, absolutely. Thanks for having me today. So I'm a Director of Program Management at Stratis Health. We're a nonprofit based in Minnesota, do a lot of work in Minnesota, but also do a lot of work both nationally and regionally. And our mission is really to innovate and collaborate and improve health. So we do that in a wide variety of ways. And my role is largely to oversee the portfolio of rural programs that we implement kind of both in Minnesota and across the country. What brought me to that space is actually kind of very directly connected. I've been with Stratis Health for 25 years, which seems honestly like kind of an impossible number.
Yeah.
But if we go back to 2000, when I started, that's about the same time that critical access hospitals started converting. It sort of aligns up with that timeline of when we were starting to see the early round of conversions. So my first role at Stratis Health was that I was a quality improvement advisor for the Northwest region of Minnesota. So for those of you who don't know your Minnesota geography, largely rural.
Yeah,
so I would be out visiting hospitals, and the first handful of hospitals that converted to critical access status were in that region. So they started talking about critical access status, and they talked about this program called the Medicare Rural Flexibility Program, or the FLEX program, and I started talking to the folks at the Minnesota Office of Rural Health and Primary Care, which ran the FLEX program. And I've just gone deeper and deeper and deeper down that rabbit hole ever since, and essentially have spent the last 25 years largely focused on rural communities, rural critical access hospitals, rural health clinics, improving quality and patient safety, improving community connections, thinking about value-based care, all things kind of combined together.
Well, what excites me is it's all things rural, and that's what this podcast is all about. And so if anyone can connect with the rural listener, it is you. And so it's so exciting to have you in the studio today and for this segment. And, I'm going to ask you a few questions. The first, let's just start talking about some of the work that you've been engaged in. But we need to define some things. So, we're talking about CMS, maternal morbidity structure measure. And some people are like, what in the world is that?
Yeah.
And I guess if you could help define that first.
Absolutely.
And give us a sense of what that actually is.
Yeah, so it's a new measure, a fairly new measure. It's been available for the last couple of years. So it's a structural measure, which is part of the CMS Inpatient Quality Reporting Program, the IQR program. So PPS or larger hospitals are required to report those measures. There's payment attached to their reporting of those. They are optional for critical access hospitals. So it's an optional measure for critical access hospitals to report. The actual reporting is somewhat simple. It's a structural measure, so it's an attestation. So whoever has access to your hospital quality reporting portal access would go in and basically say yes, no, or not applicable. So the question that gets asked is actually a twofold question, and there's two components to it. So they ask if you are participating in a perinatal quality improvement program, and if you are implementing safety bundles related to labor and delivery or inpatient care. So two parts, one question, you have to answer yes to both parts. Or if you can't answer yes to both parts, you have to say no. If you don't do labor and delivery, you can say not applicable.
Okay.
So reporting is due. So we just passed the reporting deadline. We're recording this the end of May. Reporting is due May 15th. Every year. So the deadline that was earlier this month was for the calendar year prior. So the
Okay.
next cycle for reporting will be reflecting activities that happened in 2025, and you would have to report that by May 15th of 2026.
So then so at Stratis,
Yeah.
just so I understand this a little bit, so then you're going in and you're reviewing and aggregating that data and
No,
looking
we're
at that?
just, it's
No.
data that comes out from CMS. We're just really trying to
Right.
make sure that the word gets out and that folks are
Very good.
aware about it. There's a
Okay.
lot of great activity from the perinatal quality collaboratives. There tends to be one in every state. There's a national network of perinatal quality collaboratives that we'll have the link to in your show notes. So if folks don't know who that quality collaboratives, they can make sure that they get connected to them for those resources. And really, my role has just been trying to make sure that folks are aware of it, particularly critical access hospitals, because it's not a
Yeah.
required measure for them.
Sure. So I think one of the important things is, and this will be me saying this, is the importance of our listeners today across the country, that they tune in and understand the importance of how programs like this and other programs funded by Medicaid and other services are critical to the viability of our health viability of our rural communities. And when it's at risk, like it is today, through what the acts that Congress is taking, to peel back many programs that are beneficial, programs that impact even potentially services like this, are detrimental to our communities. So if you're listening today, we ask that you be an advocate for these types of programs. The way you can do that is to let your congressional leaders know the importance of preserving Medicaid and the importance of making sure that we provide these type of services in our rural communities where there's a lack of transportation, many times a lack of providers. And these are important programs for moms, and babies, and families alone, beyond just what the impact is to our communities, to have healthy families in our communities. So you've heard it directly from me before, and you're going to hear it again. Be an advocate for our Medicaid population, for our rural communities, because these are lifeline programs that are so beneficial and impactful. So, I had to say it. That way you didn't have to worry about any political hot potato. And it's important, I think, that our listeners understand what's at risk with these type of cuts. Programs just like you've described
Agreed.
are at risk.
And I also think it's really important to note that so the quality reporting piece is just one component. So certainly the activities that folks are doing to make sure
Right.
that the quality is there and that
Are
they're
being
focusing
met.
on maternal
Yeah.
health is super
Yeah.
important. But the other thing that is different about this particular measure is that CMS has attached what they're calling a birthing friendly hospital designation to reporting of the measure. So even if you're doing all those activities, if you don't report the measure, you are not designated by CMS as a birthing friendly hospital. So, and that's one of the reasons I've really kind of been on a bandwagon to ensure that critical access hospitals are reporting it, because I don't want them to miss out the opportunity to have that sort of public designation if they're already doing the work. So that designation gets reported. It's on the Care Compare website. So if you search that Care Compare website and pull up your hospital, if you've said yes to the structural measure and you do labor and delivery, you'll have a little symbol that says you're birthing friendly. The other piece of that is that, that's Medicare. So like a lot of people don't look at that for Medicare, and maybe a lot of patients aren't actually going in and looking at that, comparing hospitals, particularly in rural, but I think it's an important public designation. You're also having several of the large payers include that designation in their provider guides, their provider network guides. So if I'm on commercial insurance and I'm looking up, if I don't see that designation, does that mean something to me? Because all these other hospitals have this little designation. So at this point, that birthing friendly hospital designation is solely attached to saying yes on the maternal morbidity structural measure.
And
so
that is
super important.
So that is, it all rests on that question.
On reporting that measure, yes.
Wow. Isn't that unbelievable?
So
I mean, that's how important this
has
is.
indicated in the future that they are likely to kind of roll in additional measures and components to that. But right now, birthing friendly hospital designation from CMS is just on that structural measure that needs to be reported.
So they report this structural measure, right? I want you to help our listeners understand how. Let's say that there are critical access hospitals today that are not participating. Where do they start? How do they gain access? Where is the first place they need to look? And what happens after?
Absolutely. So there is, I believe at this point, there is a state-based perinatal quality collaborative in every state. CMS has written the regulations, so it's a little soft, but it's largely state lines that those are structured through. So the first place would to be make sure that you're connected with your state-based perinatal quality collaborative. And again, I'll have the link to the national network so folks can find that. And they're the ones that then can help kind of point you to the resources. There's also the AIM Bundles, Alliance for Innovation in Maternal Care. And so they have the patient safety bundles. So you're not required to use AIM bundles, but they are an excellent resource. I'll also have the link for that with the show notes. But taking a look at those patient safety bundles and working on implementing those. And that oftentimes goes hand in hand in providing support and participating in those perinatal quality collaboratives. So really just encourage, especially, we're not even halfway through 2025, so there would be opportunities to make sure if you're not already engaged in those activities that you could be doing that at some point in 2025 so you could attest positively to that measure. Again, it's all actually really about the patient safety and the care that you're providing. This is just a way to kind of help ensure that you're getting demonstrated. And then there's some really great tools and resources out there available to support implementation of that work.
So you heard it directly from Karla Weng, Director of Program Management for Stratis Health, who said there's still time for you to participate in programs. We would encourage you to reach out to your local hospital association. Many of those have the collaborative, the quality collaborative as part of this, your Center for Rural Health and or Stratis Health. They'll be more than glad to help direct you. If you're a critical access hospital looking for designation, this is one way for you to achieve it, and there is still time left. So it has been great to have you on the podcast. Before we close, because this is our abbreviated version, before we close, we like to wrap up with a closing segment about rural health recommendations. And for every guest, you bring to the table a wealth of information and a background far better and greater than anyone else in your field. And so it's always great to tap into the wisdom and knowledge of our guests. And what we actually do is we ask our guests to contribute a recommendation on rural life and or rural healthcare. And it could be a tip for someone who is new to working in rural healthcare. Maybe it's a new leader rising up. Maybe it's someone who wants to get involved in rural health as a volunteer or programs. Maybe it's someone who's just thinking about how can I impact my community? Whatever it is, do you have a tip for someone who is new, working, maybe an advice, some sage advice on thriving in that rural setting that you can share? And then what we do is we will place that recommendation that you give to our listeners on our website, ruralhealthtoday.com, and we will make that available to our listeners so that they can get from you, the industry expert, what your recommendation will be. So Karla, the $1 million question of today. What is your rural health recommendation?
Yeah, well, I don't know if it's sage advice, but it's something that holds through, I think, that we try to implement it across the board in our Stratis Health work related to rural facilities. And that's really to focus on assets instead of gaps. So I think when we're working in rural communities and trying to support rural communities, if we live in rural communities, it's really easy to focus on the things that you don't have. We don't have specialists. We don't have this. We don't have that. But I think oftentimes we forget to focus on what you do have, and that there's really, when you start to think about what is there, the wealth of resources and how you can connect the dots across those resources is pretty amazing. So that's really my tip, is to focus on what you have and then think about how you can use that to address your gaps.
Absolutely. My pastor just gave that sermon the other day. Focus on what you have and instead of what you don't have, and then you'll be blessed. So thank you, Karla, for your recommendation. It's some great advice, and I appreciate you joining us today on Rural Health Today. Thanks for joining us.
Yeah, my pleasure.
And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you've subscribed to wherever you get your episodes from podcasts. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network, Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.